This is a unique opportunity for you to hear about the work that they do here. And I would now like to introduce my UHN colleague, Dr. Mark Bayley, to open today's session on stroke matters and serve as our MC today. Welcome, Mark, and thank you to everybody for coming.
Thanks, Gilliam, and welcome everybody, and thank you to all of our supporters. We hope to present some of the work that many of you have helped to support, and I thought for the first few minutes I would just highlight a little bit about what's new in stroke and what's going on in stroke and why you should know about it. And Gillian's already introduced you a little bit to what stroke in Canada looks like. I'll touch on what happens during a stroke and why you really should think fast, how you can prevent a stroke, and why is stroke rehab critical. And then my colleagues are going to help you to understand some of the work and the new emerging understanding of what happens in the brain after a stroke and how we can influence that with research. So as mentioned previously, a publication that we had a few years ago was identified that about 400,000 people were living with the effects of stroke. And we estimated that in the next 20 years, that number would close to double to 780,000 living with the effects of stroke. Now, many of you will think of men as the people who experience stroke, but actually, we've looked at this as well in a report, the 2018 stroke report from Heart and Stroke highlighted that actually stroke is a women's disease, and 70% of women don't know it, and most of the population don't recognize that 1/3 more women die of stroke than men. So we need to think of this as a disease for all of us that we all face. So what is a stroke? A stroke is, there's two kinds of strokes, and both of them involve disruption of the blood flow to the brain. The most common kind of stroke is known as ischemic stroke, where the blood flow to the brain is clogged or stopped, and it occurs frequently from aging of the arteries or atherosclerosis, a narrowing of the arteries. And gradually the narrowing that you can see here leads to a problem with the blood flow, which when a clot forms results in a problem. That problem, either the clot can occur with breakup of the artery or come from the heart, then blocks the flow of blood to an area. It travels up the artery until it lodges, and when it lodges, it blocks the artery so that the blood flow to an area of the brain is occluded. And therefore, you can see that the black area in our diagram here, or the dark area, is one example of one branch of an artery that was clogged, and that's the area of the brain that's affected by it. The second kind of stroke is called a hemorrhagic or bleeding stroke, and this is frequently due to either an aneurysm or high blood pressure, where small arteries of the brain rupture and bleed into the brain tissue. What that results in is if the blood is leaking, then you do not have access to that blood. It's going into the brain tissue and not supplying oxygen, and you get a similar kind of picture of problems related to that area of the brain that's been affected. And we know that depending on where your stroke is, you will have a certain type of symptoms. And so if the stroke is in the front part of your brain, you will notice troubles potentially with speech, troubles with thinking and problem solving. If it's in the middle part of the brain, you may have troubles moving your arm or leg, where the leg is at the top of the brain and the arm and face are further down, closer to the green. If it is in the yellow area, you will notice people will have difficulty with sensation, as well as recognition of their body, as well as recognition of others. And they also may have difficulty understanding language or reading. And similarly, if the stroke is at the back part of the brain, they will have difficulty with vision and or coordination. So you can see that stroke depends on where the blockage is. And that's why you need to think fast. And this is why the Heart and Stroke Foundation and many countries around the world have used this mnemonic, which stands for face, arms, speech, and time. Because the most common symptoms of stroke involve either the face drooping, the arms not working, speech, and we know now that time is brain. So remember those signs fast. Face, arms, speech, time. Why is time brain? Well, we already heard that every minute matters. If you clog the brain or the bleeding starts, the brain tissues start to die off very, very rapidly. They do not deal with lack of oxygen very well, and after a few minutes, the brain is already losing nerves at a rate of millions of nerves per minute. And we now have the ability, through hyperacute treatment, to actually, in certain kinds of stroke that are larger artery, to go in with a catheter, as you can see in this diagram, and actually pull the clot out of the brain, which can be literally life-saving and literally brain-saving. And that's called endovascular therapy. But even for those people who are not candidates for endovascular therapy, we also have a medicine known as TPA, which creates clot-busting action, which is important for removing clots in people who have ischemic-type strokes. So it's really critical for all of us to recognize why you should do this. So things that you can do, we know that if you manage your risk factors for stroke, you can reduce your risk of stroke markedly. And we know that stroke risk factors are also associated with heart disease and even cancer. So paying attention to these very same risk factors will reduce your chance of cancer, stroke, heart attacks, and believe it or not, dementia as well, because we know that many people have silent strokes, which then eat away at their brain capacity. So it's really important that you know your blood pressure and you try and manage it as close as you can to the normal range, that you exercise at least 150 minutes per week, that you have a moderate alcohol intake, that you eat a diet that is higher in fiber and limited in salt intake, that you pay attention if your heart is palpitating, because we know that atrial fibrillation is one of the causes of stroke. And it's also good to get a good night's sleep. And research that we've done at Toronto Rehab has identified the linkage between sleep apnea and risk of stroke. And so we know that people who are very heavy snorers and who stop breathing at night put an incredible amount of pressure on their brain, because what they do is they're not breathing, and that creates hypoxemia and can cause problems with the blood flow to the brain. So why is rehabilitation critical? Well, because the brain is uniquely primed. Only a few days after the injury, the brain is ready to repair itself. And rehabilitation takes advantage of the brain's innate ability to reorganize by either resolution of temporary factors, which you're going to hear about, as well as rewiring. We know that rehabilitation reduces death or disability by more than 50%, and it looks like more intense, the better. So at Toronto Rehab, what are we doing? We are Canada's first stroke rehab center that received the Accreditation Canada Stroke Distinction, and we've continuously had that now for over 9 years. It involves us being assessed by external reviewers against the Canadian best practices, and some of our team members, I see Carl Wong and Edith, were very involved in achieving stroke distinction again this time. And we will just quickly introduce you to some of our research that relates to stroke. We are very interested in the recovery of balance and mobility after stroke, and we have an mobility innovation center. We have the Rocket Family Upper Extremity Clinic that provides unique treatments. We're looking at aerobic exercise after stroke. Early on, we believe that the brain may be primed to recover by doing fitness training. You'll hear about some of the work from us about functional electrical stimulation, communication, swallowing, and also we're very interested in beginning the work of telerehabilitation more extensively. And so in summary, stroke is the third leading cause of death, and it affects as many women as men. You need to know the signs fast and really manage your own risk factors for stroke. And you're going to hear today about how critical rehabilitation is to recovery.